This is just in case of American Newscape. Please join Dr. Elizabeth Lee Vliet and myself providing a glimpse into the war on COVID-19. Hello, Dr. Vliet. Welcome to American Newscape.
Good morning, Justin. Thank you for having me.
Well, thank you for joining us. Let's get started. Can you elaborate on what you and your fellow physicians are dealing with trying to prescribe off-label drugs?
Well, the thing that has happened with the controversy about the use of hydroxychloroquine to treat COVID-19, the FDA issued an emergency use authorization on March 28th that specifically authorized approval on an emergency basis for the use of hydroxychloroquine to treat COVID-19 patients, but it limited the authorization to those who were in the hospital, which is the much more serious end stage of the illness spectrum. And that ended up creating a situation where governors of a number of states and a number of state medical boards have threatened disciplinary action against doctors prescribing off-label for outpatients. And I want your listeners to understand that under the normal FDA regulations, physicians have always been able to prescribe an FDA-approved medicine off-label for what it was approved for to use for new conditions that a doctor in his or her best judgment thought might be helpful for that patient and safe for that patient. Initially, hydroxychloroquine was approved for the treatment of malaria, was derived from chloroquine, approved in 1934 to treat malaria, and so it's been used for decades globally to help reduce malaria problems. And so then in 1955, hydroxychloroquine, the sister drug derivative and a safer form of chloroquine, was approved by the FDA for treating malaria. Later, doctors began to use it to treat rheumatoid arthritis patients and lupus patients and found it was extraordinarily successful and safe for those patients. In fact, many of the rheumatoid patients and lupus patients will be on Plaquenil, that's the brand name for hydroxychloroquine, will be on it for years with no significant safety problems. And recent research has shown, and this comes from basic science research that goes back to our own NIH in 2002 with the SARS virus and other countries working on it at the time, looking at drugs effective against the SARS coronavirus that broke out in 2002, 2003, looked at the basic science of how the medicine worked, and then studies since then and clinical studies in other countries since then have shown that hydroxychloroquine actually blocks the virus from attaching to the cell surface membrane, which means it helps prevent the virus from getting into the cells of our body to start the infection. It also acts, hydroxychloroquine is interesting because it acts as like a boxcar carrying zinc. The ion, the positively charged ion zinc, normally can't get across the cell membrane very well, and hydroxychloroquine is like a carrier that picks it up, carries the zinc into the cells, and the two together block the virus from multiplying itself. So here we have the medicine stops the cells being infected, and it stops the virus from replicating if it gets inside the cells. And then that helps to reduce the severity of the illness, reduce the possibility of someone being so devastatingly ill they have to go to the emergency room and hospitalized and in an ICU and on a ventilator. The whole cascade of problems is prevented. And what is fascinating to me, I've been digging into this for the last 2 months, looking at the basic science, looking at the clinical information we're getting and outcomes from other countries. And the countries that have been the most successful in stopping the COVID virus early have been the ones who have gone quickly to prescribing hydroxychloroquine at the beginning, mild manifestation, the early symptoms, or when someone tests positive, they've been using it very early in the process and actually having incredible success. The French infectious disease specialist, who's one of the leading communicable disease specialists in the world, has a series of almost 1,100 patients now that he has treated early in the disease with hydroxychloroquine, azithromycin, zinc, and vitamin C. We have a similar series with a doctor in New York State who has treated all of his patients outpatient early on, and similar results. Out of over 1,000 patients Dr. Zelenko in New York has treated, he's only had 7 patients at last count who had to go into the hospital, which is an extraordinarily low number when you look at other models where they're not using hydroxychloroquine so early. So the countries, South Korea has certainly been a demonstration of that. Brazil, France, and several others that have used hydroxychloroquine early in the infection have clearly shown success in therapy and therapeutic response, people getting well and recovering, not having so many people go to the hospital, and they haven't had any of the problems with the cardiac deaths that we keep hearing as these dire warnings in the US media. In fact, the other interesting observation, which again goes to clinical outcomes, it's not a randomized trial, but if you look at the rheumatologists who've been prescribing hydroxychloroquine for decades to treat their rheumatoid and lupus patients, the rheumatology guidelines in the United States don't even require a baseline screening EKG before starting someone on Plaquenil hydroxychloroquine. It's been that safe over all of these decades. And what's also interesting, Dr. Oz, who had started a clinical trial in New York in the outpatient setting using hydroxychloroquine, Dr. Oz was being interviewed the other night, and he said that he had been discussing this with one of the leading rheumatologists at his medical center, who has over 2,000 patients on Plaquenil hydroxychloroquine, and no one in the group of rheumatoid patients whose immune system is compromised, so you'd think they'd be at higher risk, but no one who in that database who is on hydroxychloroquine for the rheumatoid arthritis has come down with COVID. And that's a situation where we know that New York is the hotspot of the outbreak in this country. So that is very striking. The odds of that happening by chance are practically nil. So we have very good clinical outcomes and clinical data correlations that are extremely important. And we don't have time to ramp up a randomized clinical trial. That takes months to years to get all of that done, to get a randomized clinical trial designed, approved, get patients recruited, get the patients treated, and then analyze the data. In a national emergency like this, when the whole country shut down economically, as well as we are concerned about people being sick and dying, and we have those very real concerns, you haven't got time to do a randomized clinical trial. And I understand that's what Dr. Fauci ideally wants. That's the gold standard, to show definitive correlation. But when you're in a war and you have boots on the ground, people trying to fight the battle at hand, you have to use the tools you're given and that you have available and that work in other situations and apply them in this one. That is why it needs to be under the prescription of a physician who knows the patient. And the doctor and patient decide together what's right for that patient based on their other medical conditions and based upon how symptomatic they are and what the tests are showing. So when we have governors intervening and medical boards and pharmacy boards intervening and directing and dictating what doctors can and cannot do with one drug when we have a national emergency and people dying, that's just unprecedented. I've never seen anything like this in my entire medical career.
The fact that medical workers, first responders, and the frontline warriors are not only having their medical decisions blocked, but they also continue to be threatened with disciplinary actions. That's very, very difficult for we in the public to comprehend. To assist with those battles, what do medical doctors require from us?
Well, one of the things that I think patients need to understand is that there is a unprecedented fear mongering in the media from reporters who know nothing about medicine, know nothing about medical practice, are not in the business of prescribing medications, evaluating patients, determining what's right. And the fear mongering that I've heard on the various cable news networks is just truly staggering to me because, number one, it's flagrantly wrong in the way they are exaggerating the risk of hydroxychloroquine. Common sense, consumers have more common sense than some of the people that are preaching to us from the media. And consumers have the understanding that obviously, if a drug were truly as unsafe as what the media is claiming it to be, it would have been taken off the market. I mean, we had a problem with something like GI bleeds with Vioxx, which was a over-the-counter non-steroidal, or it's in that same class as the over-the-counter ones. And the FDA took it off the market quickly. We we have regulatory protections in place if a drug is truly dangerous. But hydroxychloroquine has been prescribed in third world countries around the world, people who don't have adequate care, medical evaluation. They couldn't do some of the baseline evaluations we can do. And yet it's been safe enough, the World Health Organization, whether you believe everything coming from the World Health Organization or not, prior to all of this, they had ranked hydroxychloroquine as one of the safest and most effective medications in our arsenal, particularly in countries hard hit with diseases like malaria. So the fear mongering is absolutely out of proportion to the risks that have ever been reported for hydroxychloroquine from all the countries around the world that have used it. It's literally been prescribed in billions of doses over the last 65 years. So consumers need to put the risk in perspective. In addition, if you are properly taking the medication, any medication, and that includes what's referred to as natural medicines as well. There are a lot of natural medicines that can be toxic in high doses as well, or can cause serious drug interactions. If you're taking any medicine, you should be working with your physician who knows you and knows your risk. And then it can be done safely. And if you do have problems, it can be quickly stopped. The problem is that coronavirus, if left unchecked, if we don't treat it early, starts to cause damage to critical organs throughout the body. And that in turn creates the inflammatory reaction when the body is desperately trying to mount an immune response to combat this invading virus. Then the inflammatory response itself becomes more damaging. That's what people refer to when you talk about the cytokine storm that's causing deaths because of the damage of all of the immune cells going out of control. The virus is out of control. The immune response is a massive, overwhelming, additional source of problems and complications. That's what's leading to the acute respiratory distress syndrome, that people end up needing to be on a ventilator. And quite frankly, being on a ventilator carries its own risks that are far greater than the risk of side effects that have been reported over the years with hydroxychloroquine. Dr. Oz pointed out that the rheumatologist in New York that he had been talking with said, I've treated thousands of patients with hydroxychloroquine. Biggest problem people complain about is a rash. So it's truly tragic at a time people most need to have the medical profession be seen as supporting them and helping them and available to treat them. We're getting reporters practicing medicine on television screaming about the dangers of a drug that they really don't know anything about other than what someone handed them on a script that morning to read. And yet, practicing physicians who've been using the drug successfully for decades are being ignored or, as it turns out, being threatened with disciplinary action for making a medical decision on behalf of the patient. Now, there's some positive news on that front if you'd like me to go into it.
Absolutely.
Senator Ron Johnson heard an interview that I did on a Milwaukee radio station earlier this week and called me yesterday and asked what's going on with this situation with doctors being threatened by medical boards and disciplinary action and the governor's emergency orders. The president thinks that the FDA has approved it. And I explained that the approval was for hospitalized patients and that the successes from other countries are coming in with other countries. India, for example, their national medical board has recommended, and so has France and so has Switzerland, have just recently recommended that they start using it to help prevent doctors and nurses from getting sick, in addition to starting early in patients. But we're waiting until too late. We're waiting until the hospitalized situation. So I explained that to him, and he said, how can I help? And I told him that we needed 2 steps for the president to take. Number one, issue a directive to the FDA to clarify the language in the emergency use authorization to include outpatient and hospitalized use. And number 2, we needed a presidential directive to address the abuse of medical boards and governors who are restricting doctors' legal ability to prescribe a medicine off-label in their best clinical judgment for a given patient. It would actually fit with the right to try legislation that the Goldwater Institute pioneered and Senator Johnson was involved in helping to get passed when President Trump got that signed in his administration. So he said he needed a letter to President Trump from us as physicians, and he needed to have at least 100 signatures. We got working on that yesterday afternoon. On Thursday, April 9th, the letter went out to practicing physicians across the country in our database, and that was about 6 p.m. And within the first hour, we had over 350 physicians already had signed it. This morning, when I checked and we sent it off to Senator Johnson, we sent it in at 8 o'clock this morning with 776 physicians signing, asking the president to lift those restrictions so that they could treat patients. Shortly after we sent that to Senator Johnson, I got word from our medical organization that a doctor in Florida had just been served with a federal grand jury subpoena to appear in court on May 5th for investigation of possible criminal violations for prescribing hydroxychloroquine off-label to outpatients.
Wow.
Quite frankly, Justin, that is terrifying. Here you have doctors and nurses across the country risking their lives to treat patients. They're risking their lives and exposure to them that in turn can infect their family to take care of patients. And now they're being threatened with disciplinary action and this criminal grand jury subpoena. That's just absolutely terrifying to think that we have such a police state action on practicing physicians who are doing their best at a time of a national emergency. And I honestly think Senator Johnson was totally shocked by that. And he asked me to get him the information, which I did. And he is going to do what he can at the federal level to bring it to the president's attention. Because I honestly cannot believe that our president and vice president, who have worked so hard to bring the forces of the federal government to bear in a coordinated way to fight this new virus, I can't believe that they meant that the force of the federal government would be then used to prosecute doctors for trying to do their best to take care of patients in an unprecedented situation. When we have an old drug that works and we have a new disease that we learn from other countries can be helped and people can be saved. So that's the bottom line as I see it as a practicing physician. I understand the academics in Washington and the NIH want a gold standard randomized clinical trial. But quite frankly, when you're out here facing the patient and their family and people are dying, you want to try what works and you want to be free to do that without thinking the government's going to come after you and prosecute you for criminal activity for doing your best to help someone survive.
Well, Dr. Vliet, I want to personally thank you for fighting this battle for us. And it seems like it's a battle, and it's
It is.
ongoing. This has been Just in Case and Dr. Elizabeth Lee Vliet sharing a glimpse into the war on COVID-19. I want to thank everybody for joining us. Doctor, if it weren't for social distancing, consider yourself hugged. Uh, you've given us some hope. There is some light at the end of the tunnel, and there's people out there fighting the good battle. Additional information and links are provided in the videos Read More. And I want to remind everybody to support humanity everywhere. Plus, please consider subscribing to this channel. Thank you.